Welcome to another edition of Senior Talks, an exciting new educational program for those age 45 and older in the Harris County area. Senior Talks features various presentations on opiate use, medication management, recovery, and overall health. Senior Talks is sponsored by the Harris County Area Agency on Aging and the Wellderly program through the Council on Recovery. Today we have Leah Bell, and she is going to share some information with you all regarding detox and treatment. Take it away, Leah.
Hi, and welcome to another segment of Senior Talks. As mentioned, we're going to talk about detox and treatment options for older adults with substance use disorders. Our objectives are to understand the unique problems of identifying older adults with substance use disorder, and also some of the unique problems with assessing and screening older adults. Also, we're going to describe and utilize a screening technique. The objective is to identify older adults who would benefit from the interventions that are available. And lastly, we're going to discuss the screenings. We're going to discuss interventions. We're going to discuss detox and the treatment options that are available for older adults with alcohol and prescription drug use problems. Okay, although it appears that alcohol use declines with increasing age for most older adults, but for some, it marks the beginning of alcohol-related problems. It is estimated that 17% of the adult population have an alcohol or prescription drug problem. And so there are two classifications of problem drinkers. One is early onset. This group of individuals or older adults had begun drinking earlier in life, typically around 20 or 30 years old. And they have a long-standing heavy drinking problem, and they have reached the age of 60. The late onset group of problem drinkers are those that begin their problems with alcohol later in life. And they make up 1/3% of older adults with alcohol problems. Now, as for the older adults that again are the late onset problem drinkers, they appear to be psychologically and physically healthier, but they tend to they're likely to have begun to increase or begun alcohol use due to losses such as death of a spouse, divorce, medical issues or conditions, and retirement. Now both early and late onset problem drinkers appear to drink mostly every day. And they drink in non-social settings, which means they drink at home alone. Now, both the early and the late onset heavy drinkers are likely to use alcohol as a self-medicating device rather than a socialization agent. Now, it is estimated that 87% of older adults see their doctors on a regular basis. 40% of these older adults who are struggling with alcohol problems or prescription drug abuse issues will not tell their physician, nor will they seek help on their own. The warning signs of alcohol and other drug problems can easily be confused or masked by other conditions, current illnesses that mimic the symptoms of alcohol problems, such as sleep problems, confusion, falls, anxiety. They all can be due to non-alcohol diseases or disorders. Now, despite the many visits that an older adult makes to their doctor, the doctor can not detect the alcohol problem in the older adult because of those issues or those conditions that are associated with other diseases or disorders that are not connected to alcoholism, or they could simply dismiss those symptoms as part of the aging process. Now, let's talk about when and who should be screened, or ideally, every 60-year-old should be screened for alcohol and prescription drug abuse as part of their regular examination. Now, when the older adult is undergoing a life-changing event, such as menopause, empty nest syndrome, which that means all the children are out of the home, approaching retirement, assuming the role of a caretaker for a sick relative, or gaining custody of their young grandchildren. Any of these events should trigger an alcohol screening. Now, the goals and the rationale for alcohol screening in older adults are to identify a risk drinker, an at-risk drinker, a problem drinker, and or a person with alcoholism, and also to determine the need for further assessment. Now, the rationale is that there's high enough instances to justify the need for screening and assessment for older adults. The adverse effects of quality and quantity of life is apparent, and there are effective treatment for an older adult that is available. And also the screening techniques, they are inexpensive and available. Now, there are screenings and assessment techniques that can help identify an older adult with substance use disorder. A screening can be done as part of a presentation, say like on a topic of the effects of alcohol, or during the seniors talks segment. Yes, that's right. We're going to do a screening. The tool that we're going to use is called the CAGE screening tool, which consists of only 4 questions that can be answered with a yes or no. So let's get started. 1, have you ever felt like you should cut down on your drinking? That would be a yes or no. And I hope you're participating. 2, have people annoyed you by criticizing you about your drinking? 3, have you ever felt guilty about your drinking? 4, have you ever had an eye opener, which is a drink the first thing in the morning, to steady your nerves or to get rid of a hangover? So the way we would score this is that 0 is for no and 1 is for yes. Answers with a high score is an indication that there is an alcohol problem. A total score of 2 or more is considered clinically significant. However, if someone answers want to any of these 4 questions, they should be referred to a clinician to be further evaluated. So how did you do? Okay, there is another screening that is more age specific for older adults, and this is the MATG. This is, the name for that is the Michigan Alcoholism Screening Test Geriatric version. This screening consists of 24 yes or no questions. A score of 5 or more yes responses indicate an alcohol problem. And no, we won't do this screening. So now an older adult who has a positive screening result would then go on to have an assessment, and the assessment will be done by a clinician, and it will be to confirm the problem, to characterize the dimensions of the problems, and to develop an individual treatment plan. And we're going to talk about the dimensions of the problem later on in this discussion. So there are 3 least intensive treatment options. One is a brief intervention. So in a brief intervention, the older adult has 1 or more counseling sessions, which may include motivation for change strategies, client education. It should include assessments and direct feedback, contracting, and goal setting. An older adult specific brief intervention should include customized feedback on the screening questions relating to alcohol patterns and other health habits such as smoking and nutrition. Consequences of heavy drinking would be explored. Reasons to cut down or to quit drinking would be discussed. There would be a written contract as to how a written contract in agreement to cut down and modify drinking levels. Coping with risky situations will be discussed. And finally, a summary of the session will take place. And this would be for each intervention. Brief intervention, I'm sorry. So now research has shown that 10 to 30% of non-dependent problem drinkers reduce their drinking to moderate levels following a brief intervention. Now, if the older adult problem drinker does not respond to a brief intervention, there are still 2 other least intensive approaches that can be utilized. So the other approach would be intervention. This is where a skilled counselor aids several significant people in that older adult's life, and they would confront that older adult with their firsthand experiences of that older adult's effect on them because of their drug use and drinking. Now, due to there being 2 stigmas that an older adult has to face, there's certain individuals that should not be in this intervention. One mainly being the grandchild. This would put the older adult in a place where they're feeling judged or ashamed. And so because of the two stigmas, one being alcoholism and the other being, unfortunately, old age, it puts another barrier in the way of that individual actually being able to take in this intervention and really be able to see their behavior in the moment of their drinking problem. Okay, so then the third least intensive approach is called motivational counseling. Motivational counseling acknowledges the differences in readiness for change and offers an approach for meeting people where they are. And this has shown to be very effective for the older adult. The key components are to accept that older adult's perception of what's going on, to roll with resistance, to allow the person to express their ideas and thoughts in the situation, and to help them through the ambivalence of change. We can help that individual to shift their perception about drinking and their prescription drug use habit. Through motivational interviewing, which is counseling as well, is to empower the older adult to generate insight about their situation, and for them to be able, through that insight, find solutions for their problems. Now, with the motivational counseling, the counselor would share and express the belief they have in that older adult to be able to change. So now, after all of this is done, the first thing to consider before going in, having a person or an older adult go into a more intensive treatment, is to consider whether detoxification is warranted. Because detoxification for an older adult is considered to be medically risky. So most often the older adult will be hospitalized, and there are some cases where they can do it at home, depending on their support systems. So the indicators to confirm whether inpatient, hospital-based detox is most warranted is the potential for dangerous withdrawal symptoms, like seizures or delirium. Now, the symptoms for the older adults are more severe and they last longer. And so that would be an indication that they need to be hospitalized for the to be withdrawn from their substance. Suicidal ideation is another reason for hospitalization, or even the threat of suicide is a reason for hospitalization. Unstable medical conditions such as renal disease or diabetes, mixed addictions, drinking and taking sedatives, that is a very risky situation. And also the lack of social supports at home. So the recommendations for detox medication for an older adult is to avoid higher half-life of medication, to avoid poisoning. For some older adults who have a liver disease, the toxification could occur due to the medication the drug sitting right there in the liver, and so it can send out poisoning. And also to help to prevent persistent cognitive impairment. Now, a half-life is how long it takes for a drug to become half effective. So say you're given a prescription and you are instructed to take it every 4 hours. So what that means is that half-life for that medication would be 2 hours. So 2 hours after taking that medication, it would be for a 100 milligram pill, it would be 50 milligrams within 2 hours. Use of shorter acting benzodiazepines, especially for patients with liver disease, and like I said, to avoid poisoning. Also, great caution should be used when clonidine, methadone, and phenobarbital are used. Sedation regimen should end in fewer days. Also, because withdrawal symptoms may appear after detox is completed, observation is needed. So that's why they want, when I say they, I'm talking about the University of Michigan Department of Psychiatric Director of Serious Mental Illnesses would suggest that you end the sedation regimen will be ended earlier before the release from detox. And also, supplemental dosages of thiamine, folate, and multivitamins should be given, especially for older adults detoxing from alcohol due to the depletion of vitamins associated with excessive alcohol use. So, treatment. There are 6 features that should be incorporated into a treatment for older adults, and that is an age-specific group treatment that is built to increase self-esteem. It should focus on coping with depression, loneliness, and loss, because those are the reasons why older adults typically use. Should be focused on rebuilding their social networks. A lot of times older adults tend to isolate and they lose connection with socializing with others. The pace and the contents of the treatment should be appropriate for an older adult. And the staff should definitely be interested in helping older adults and have experience in that field. Last but not least, linkage with medical services for the aging, referrals to treatment, as well as case management. So if you or someone you know needs help, please call the number that will be provided on the screen. This concludes our segment. Thank you, and please join us for another segment of Senior Talk.